Hello, I'm Karen Culverhouse, and my topic for discussion today is rhabdomyolysis. Rhabdomyolysis is a condition in which damaged striated skeletal muscle breaks down very quickly due to either a mechanical, physical, or chemical injury. When this damage to the muscle tissue occurs, creatine phosphokinase enzymes, muscle proteins such as myoglobin, and other cell byproducts are released into the bloodstream. Some of these byproducts, particularly myoglobin, can accumulate in the kidneys, block kidney structures, and result in acute renal failure. Also, dead muscle tissue can cause fluid from the bloodstream to move into the muscle, reducing normal volume of fluid in the bloodstream and can lead to shock. Potassium leaking from the damaged muscle can lead to hyperkalemia, which could cause fatal changes in heart function and rhythm. Mechanical causes of rhabdomyolysis include sustaining a crush injury, burns, compression on muscle for an extended period of time, and compartment syndrome. Physical causes include hyperthermia or heat stroke, electrical injuries including lightning strike, and excessive physical exercise. Chemical causes include medications, alcoholism, drug abuse, electrolyte abnormalities, infections, and endocrine disorders. The most frequent of the mechanical causes is crush injury. This may occur in large numbers during a natural disaster, such as an earthquake or tsunami, or an event such as a bombing or explosion. With this type of injury, the muscle experiences extreme trauma and is literally crushed. Acute renal failure due to rhabdomyolysis has been found to be the leading cause of hospitalization and fatalities for those who survive an event such as this. Typically, the initial treatment for those sustaining a crush injury would be administering IV fluids to achieve diuresis and possibly include bicarbonate to prevent kidney damage. In a mass disaster such as an earthquake, there may not be sufficient resources to provide adequate treatment for the number of people involved. A recent study, however, proposed the use of an oral alkalinizing solution in situations such as this. This was tested on 12 subjects and shown to achieve urine alkalinity within a few hours with no adverse side effects. This may be a possible alternative to standard care during a state of emergency and an interim solution when supplies and personnel may be unavailable. Oral alkalinizing solution could help to decrease rates of kidney failure due to rhabdomyolysis following natural disasters. The most common physical cause of rhabdomyolysis is extreme physical exertion, such as high-intensity fitness training. In past years, this was seen more commonly in the armed forces due to extremely rigorous boot camp training. Also, elevated body temperatures and hot, humid climates during training contributed to this. Even trained athletes, such as marathon runners or weightlifters, can suffer from this condition. In more recent years, however, rhabdomyolysis has been increasingly linked to high-intensity workouts, such as CrossFit. Often, deconditioned people are joining these clubs and asking their bodies to perform beyond what they're capable of for an extended period of time and without proper hydration. They push their muscles past their limit, ignoring muscle pain and fatigue, and the sodium-potassium channels exchange is disrupted. ATP becomes unavailable to provide the muscle with the energy it needs, and ultimately this leads to muscle damage. A recent study examined the effects of high-intensity exercise on a group of healthy subjects who exercised regularly. The subjects' creatine kinase levels were measured before and after the exercise regimen. It was found that the creatine kinase levels were markedly elevated after the intense boot camp type exercise, but did not reach the level that a diagnosis of rhabdomyolysis would be given. Therefore, the authors found that the physiological benefits of high-intensity exercise would outweigh the risks of rhabdomyolysis in a healthy population of those who exercise on a regular basis. It seems that those who are deconditioned that begin a rigorous program such as this are more likely to experience this condition, but we need more research to be done to confirm that. The typical symptoms of a patient with rhabdomyolysis are muscle pain and tenderness, fatigue, discolored urine. It's usually a brown tea color. The reason for the urine discoloration is the presence of myoglobin in the urine. Patients may also present with nausea, vomiting, fainting, or confusion. Tests can be run to determine the level of creatine kinase present, and this is usually a direct reflection of the amount of myoglobin in the bloodstream. Also, the patient history would be of great value in determining the likelihood of having this condition, such as alcohol and drug abuse, recent exercise activity, or recent infections. This condition can affect individuals of all ages and backgrounds. Initial treatment will focus on preventing kidney damage and possible acute renal failure. IV fluids will be administered to hydrate the patient and achieve diuresis, and bicarbonates may also be used. The patient's breathing and heart rate will be monitored. For those patients who have this condition due to the use of statins, which are medications to reduce cholesterol levels, and they have no other contributing factors, they'll be taken off the medication. The primary goal with these patients is to bring their electrolytes back into balance and creatine kinase and myoglobin levels in the bloodstream back to a normal range. Since there are varying degrees of this particular illness, mild to severe, the prognosis is patient-dependent. In milder forms, the patient may receive IV fluids for 24 hours, and then they may be released with no further symptoms or complications. In severe cases resulting in renal failure, the patient may require dialysis and extended hospital stay. Following the initial treatment for rhabdomyolysis, the patient may be referred to physical therapy. These patients would fall under the 4C practice pattern for impaired muscle performance. The main impairments would be loss of muscle strength, power, and endurance. And the functional limitations would be dependent on the patient and the amount of time they were immobile due to hospital treatment or the severity of the crush injury. They may be unable to perform activities of daily living, such as sitting for prolonged amounts of time at their workstation, cleaning house, performing personal hygiene activities, or even being able to walk unassisted. Some precautions to take into consideration would be in the case of crush injuries. The patient may have fractured bones or open wounds. Physical therapy treatments in these cases would be dependent on the severity of the injury and the level of immobilization of the affected muscle. The surrounding tissues and bones would need to be able to heal before increasing strengthening exercises for the muscles affected. When treating a patient who had rhabdomyolysis as a result of statin medication, it would be important to assess the muscular strength of the proximal muscles, such as the inspiratory muscles. You would need to carefully monitor the patient's cardiorespiratory function, as they would have just stopped taking their medication. The goal of physical therapy for patients who have had rhabdomyolysis would be muscle strengthening and conditioning. This would include an exercise program designed for the particular muscles involved. Special attention would need to be paid to the amount, frequency, and intensity of these exercises so as not to exacerbate symptoms. Also, for patients who may have had an extended hospital stay to treat acute renal failure, acute care physical therapy would include bed mobility and range of motion exercises to prevent possible contractures. For outpatient cases, home exercise programs designed to strengthen and increase endurance of the affected muscles would be important. Also, patient education for those who experienced rhabdomyolysis as a result of overexertion would be very important. The patient would need to be educated on proper hydration during exercise, discontinuing exercise if experiencing muscle pain and fatigue, and proper stretching exercises following exercise. Rhabdomyolysis is not a well-known disease or condition amongst the general population, but it's important to educate people on the signs and symptoms, as the resulting acute renal failure and cardiorespiratory effects could be fatal. The leading cause of this condition is crush injury or blunt force trauma to the muscle, but the numbers are rising recently for those affected as a result of overexertion and also the use of cholesterol-lowering medications. It may be difficult to diagnose in milder cases, so the treating physicians and physical therapy staff must take special care in recording the patient's medical history and asking the appropriate questions. With prompt and adequate treatment, the majority of patients with this condition are able to fully recover and return to normal function without any lingering adverse effects. Thank you for watching and have a good day. Let me know if you have any questions.